The House bill would rely on certain shifts in the health insurance marketplace. Health savings accounts, heralded as a panacea by Republican
We have to have
leadership.
enough money to put into that.
Absolutely. Again, we're talking about the same population. You have to have enough money to set aside in your health savings account. Okay? The other thing that's relied upon are high-risk pool programs. We have experience with high-risk pools. This is not our first foray into this. The bad experiences that we've had with high-risk pools indicate that that is not a reliable solution. High-risk pools are antithetical to the insurance market. You do not segregate out all of the bad risk and put it in its own pool. Insurance is set up to spread risk, healthy and sick, in the pool together. Also, high-risk pools ran out of money when they were introduced early on as bridge programs for the Affordable Care Act. What the Republicans are proposing now in the House bill is not financially sufficient to cover any of the sickest among us in a high-risk pool program. These things are very, very concerning. Also, the House bill introduces an effective abortion coverage ban that is unprecedented. I question the federal government's authority to be able to do such a thing. It extends the scope far beyond the Medicaid program. It would limit the ability of women to use premium subsidies to buy any plan, even if the premiums are segregated, that offers abortion coverage. Again, reproductive rights, reproductive health access are threshold issues for women to participate in the economy. A woman cannot participate in the economy throughout her reproductive years without the ability to control her own reproductive cycle. This is not an accident. The same leaders have vowed to end abortion access for women. This necessarily, again, comes back to women's ability to participate in the labor market and achieve economic independence. These are too many assaults on what is proposed to be a job-supportive party at this point, and a president that claims to be economically oriented. And it is, again, on the backs of women and women of color disproportionately that we're going to see the impact of this bill if it comes to pass.
Wow. I'm struck when I listen to you, Monica, that in a different, I guess a different example, where we concentrated all of the quote-unquote high risk, in this case, mortgage loans, and almost tanked our economy, almost tanked our entire national economy. And it sounds, when I listen to you, the fact that we're, like you say, hobbling an entire population, disproportionately impacting women, people of color, the working poor, that it's almost impossible that it won't have a long-term detrimental impact on our national economy, irrespective of whether or not you have health insurance right now. It sounds like it could actually even shrink and hurt our national economy in the long run to have so many people kind of X'd out.
Absolutely, and if you look at the United States relative to other liberal democracies, our health system, such as it is, and I hesitate to use the word system because it implies a deliberation that doesn't really exist in a holistic sense. The United States is really an outlier. We are the only country where health insurance is tied to employment. We are the only country, I'm talking about in the countries that we typically are compared to. But that is, that's very significant. Whether a person has a job or not, everyone who is lucky enough to be alive has a body that will need some care at some point, right? So yeah, we are very much behind our counterpart countries in terms of having an infrastructure to support access to health care for people. We also have a unique economic hobbling system-wide because of this. We pay for care, we pay top dollar for care relative to other countries, and we are not seeing the quality metrics reveal that we are getting value for our healthcare dollars. It's just not what seems to be happening. So we know that the most expensive way to provide care would be to have people, uninsured people, delay or forego care and show up at the sickest possible point to our hospitals and then somehow pay the tab with taxpayer dollars after the fact. It's much cheaper. It is fiscally sound to have an insured population that together negotiates with drug companies and providers, that leverages the fact that we have a solidified demand side, to use the economic terminology. When we're all separate and apart, fractionalized, again, to use the economic term, that's where care gets very, very expensive. That's where our health outcomes go down as a result. That's where we do not reach our economic potential at an individual level and a macroeconomic level. And it's really a shame, is what it is.
So Mayor, I wanted to turn back to you. because as an elected official, as someone that represents constituents in a thriving municipality that happens to also have a hospital that employs a lot of constituents, but also a diverse population that falls on both sides of this, right? Both the fortunate to not have to worry as much because, you know, as at least for now, can afford their own health care, and perhaps those that are not as fortunate. So could you talk to us, just, I just want to know how you're feeling about this and what's your reaction?
So my first reaction would be listening to the three speakers on the panel is to clearly understand that my knowledge of what is taking place is limited. I'm really blown away from just the small amount of information you have disseminated to us here and to what the public's going to hear and see from you. I'm sure that our hospital, which is Atlantic Health, is grappling with the same issues of how they're going to deal with the changes that they're proposing. And the political side of it is there's clearly not enough information being put out to the public. I don't know if it's deliberate or not deliberate. Clearly, if the masses, and I mean that on all sides of the aisle, Republican, Democrat, Independent, because just because you're a Republican doesn't mean you're a wealth of finance. You could be a Republican based on certain criteria. It could be just a religious reason why you're a Republican. It could be you're very pro this or pro that. Your family is Republican, but it could clearly affect you. So it really crosses political lines. It really doesn't matter what your political affiliation is. Well, clearly, what I'm hearing, and our public should be aware of it, is the pressure has to be brought upon our elected officials who make these decisions in Washington. Each district has their congressman, congresswoman, and Republican, Democrat, Independent. You know, you hear a lot of these town halls, a lot of different stuff going on, but to hear just this small amount of information coming from three people who obviously know what they're talking about has really kind of woke me up a little bit to the fact that people don't understand what's going on, and they're not going to know until it hits them 2 years from now or a year from now when if they get these changes through. I don't think the Senate is on board with these changes, and I'm hoping that enough congressmen and women realize that this is not good for our country. You know, my role as a mayor is to reach out to our elected officials at a higher level and question them on, you know, what is their position, what is their understanding of repeal and replace, what is, do they truly understand what's in this bill? Because being around long enough, and if you ever get the opportunity to really take a look at a bill, right? Am I right? They're like this, and clearly they're not read from beginning to end. Their aides educate them on what the bill is, what's good, what's bad, what needs to be changed, what they think is good for it. It sounds to me from the little bit of information that you're putting out there that this is not good for our country. It's just not good for working class people. It's not good for minorities. It's not good for seniors. It's just not good, period. And then saying that, this is, you've got to talk more about this. I mean, it's educators like yourself who have deep knowledge of what's really going on. I mean, mayor can do a lot of things in the community, but I can't change, I can't get to the level that in education I can try with you to educate people. Clearly, nobody's talking about this. Not the way you guys just explained it.
So can I jump in here on something quickly, because I think that the mayor is bringing up a really good point. I am still shocked, and I've been around long enough to see big pieces of legislation that are yo high, right? This bill was introduced on March 6th. It's going to be voted on a full House floor on the 23rd of March, right? So the pace and the acceleration and the ability for not only actual members of Congress to read it, but for us, the general public, right, to read it and absorb it and for their hearings to be robust, for there to be expert panelists brought in for hearings, I think is really alarming. I think the other piece of this, and not to get too deep into the weeds, but this is done during reconciliation. So all of the pieces of this bill have to be tied to the budget, right? Everything is sort of tied and couched in this reconciliation process. The Trump administration continues to say that this is part one of 3 pieces in what will be the repeal of the ACA. And so I think there's just so much left unknown on what part 2 and part 3 will look like. And I think it would behoove everyone, members of Congress and the public, to see all of the pieces of what this will ultimately be. And what alarms me is when you hear folks, whether they're in the media or just lay people, I was having dinner over the weekend, and this comes up because people know where I work and what I care about, and even when I'm not at work, that's all I want to talk about.
That's why we love you, Jen.
And they said, but well, they're not doing away with pre-existing conditions, and they're not doing away with the under the Affordable Care Act, kids can stay on their parents' coverage until they're 26. And I said, you're right, they're not doing that in this iteration because those are not tied to the reconciliatory process that this bill is going through. We have yet to see the other 2 pieces of what full repeal will look like. And so I think there's just an unnecessary hastening to ram this through without seeing the full scope of what the ultimate, repeal package will look like. I mean, it's like buying a car without test driving it. Like, how are you...
Or even seeing it.
No, it's like buying a car without any Consumer Reports issue.
The scary thing is everything's on a spin on a TV show. So people are getting their information from MSNBC, Fox News, CNN, Channel 12. They're getting their news in bits and pieces, where we used to get a lot of news in a much more broader sense. So everything's in sound bites. So what you talked about, the other side will spin in a totally different way and sound like that's not the case.
And along those lines, the rhetoric that's used, which is political theater, revolves around freedom an awful lot. Okay? This sense of freedom, and that somehow the House bill will increase freedom. My question is freedom to what? Because we know that the number one reason people cite for not buying health insurance is that they can't afford it. It's not that they believe that by not buying health insurance they are somehow achieving a level of freedom that they previously were not able to attain. But if that is the argument of the Republican leadership in the House, I would suggest that they withdraw from the Federal Employee Health Benefit Plan and the Congressional Health Benefit Plan so that they can experience the freedom that they're offering to the people who will lose coverage under that.
Everyone in this country should have the same health care plan.
Yeah, but if they're suggesting repeal, if they're suggesting repeal for that population, they should stand in solidarity with the freedom that comes to those people who don't have access to health care. That's a really big problem. And one of the other issues is that the idea that people can participate economically, this reliance on jobs without access to health care, it's just not possible. The connection between jobs and health have to be understood. This gets pretty wonky pretty quickly, but I will tell you that when you're trying to communicate this to the public and people say they like the end to the pre-existing condition exclusions, but they don't like the mandate, the sad reality of it is you just can't have one without the other. They go together, and you will not find an economist who tells you that you can really decouple them successfully.
Right.
And it's a real concern that we've withdrawn the reliance on science and research that we've come to rely on. The idea that the current president would dismiss the Congressional Budget Office's analysis before it even comes out, when that is set up, in fact, to be a nonpartisan research entity on which the American people can rely. It's a big problem. And, we expect everyone to have car insurance. This is not an entirely separate issue. Everyone has to buy car insurance. And we expect that if we get into a collision with another driver, that they're going to have insurance. And there's a pool for the state for uninsured motorists to cover expenses that come from those kind of accidents. Why don't we shift that mindset to healthcare? There used to be a pool to cover the uninsured health expenses of those people, or to get them insurance, which would be the cheaper way to go.
So we can talk for hours, and sadly our hour is up. So I'd like to first share with folks that if you want additional information, and we're happy to provide and whatever information our guests, our panelists would like to put up, we're going to be putting up at www.workingfamilies.org/ACA, so that you could receive additional information and find out what you can do, how to educate yourself a little bit more about these issues, as well as the timeline, because the reality is that we're talking about a vote, sadly enough, on the anniversary of Obamacare, of actually providing all of these individuals health care or access to affordable health care. We're now talking about repealing it and making this massive leap towards what sounds just dire and dangerous and untenable for individuals, for the states, for hospitals, for all different types of constituencies. So I want to thank you again, my amazing panelists who opened a lot of eyes, I'm sure, not only of the mayor, myself, those present, but hopefully also those that are going to watch it online. Thank you.
Thank you.
Thank you.
Thank you.
All right.